Thank you for joining. This is Real Health Talk, and my name is Arafat Mugabo. Today we are going to be discussing on Spina Bifida, and in the studio I'm joined by Dr. John Baptist Nkuranga. Is a neonatologist at King Faisal Hospital and is the director of maternal, child and women's health at the King Faisal Hospital. So allow me welcome our expert in the studio to share with us more on Spina Bifida. You're most welcome, Dr.
Pleasure, Arafat, and thank you for your invitation to be here to talk about.
So, Doctor, we are looking at Spina Bifida as a serious condition that really affects newly born babies. And can you help us educate our viewers what exactly is Spina Bifida, as in a definition of it?
Thank you, Arafat, for the question, which is not very easy because the word Spina Bifida is more technical, but really in understanding we are talking about a malformation, an inborn abnormality where the part of your back that controls the nervous system, or rather your neurons were passed from for the coordination of the body, where it was not well formed. So the defect at the back of your back is what we call Spina Bifida. It is quite variable. It is a malformation that can happen anywhere on the path of the brain. To make it a little bit, explain it, is that the brain is not static, so we have the brain as we know it into the head. That the head we see is a bone structure that covers the brain, which is the brain is usually referred as the electrical coordination of the body, because the brain commands the body on what to do. For example, if I speak now, my brain tells me that it's my time to speak, and to tell me it's your time to speak and I can wait. So the brain, as we see it continues through the back, what we call spinal cord. And that is the bony part that we see, all of us, we have it at our back. So any malformation that happens into the brain structure and along the spinal cord that reads the spinal cord tissue or the brain tissue to exteriorize, to come out of where it should be covered, is globally what I would refer as Spina Bifida.
Exactly. I think it's really a very difficult term or a condition to explain, but as in, what do you think, or what causes this condition? What exactly the main cause of this condition?
Right. It's not one thing that causes the Spina Bifida. As we just heard, it's a complex issue to explain. But generally, I'll try to make it simple, is that there are a number of things that we call risk factors, not exactly what causes, and other things that do not allow the normal formation of the body into the mother's womb when the fetus is being made, when the baby is being made into the mother's womb. That interaction involves lots of factors, and if any of those factors that determine the normal formation of an unborn baby there are those factors that is specifically related to the Spina Bifida, or are risk factors for the formation of Spina Bifida. The most common one really that we encourage people is a deficiency of one of the body minerals we call folic acid. If a pregnant mother, or even before a woman gets pregnant, has a deficiency of that salt, it's a risk factor. So it predisposes, because that salt or that mineral, whatever you call it, is very critical in the formation of the spinal cord. And its deficiency then leads to a risk of of being prone to making error in the formation of the spinal cord and the neuronal tissue, and that can lead to babies born with that condition. There are many other things. The most common one, there are factors where genetically it has been seen in the family before, so there is a family pattern that can be a risk factor for that. There are medications that can be a factor for that, but especially if you're taking a medication that interfere with the function of that mineral, what I called folic acid, especially for people or young women who in their age of procreation who have seizures, especially most of the anti-seizure medication do interfere with the metabolism of that folic acid, and therefore can be a risk factor for the neurotube defects, as we call them, or spina bifida. Also, being obese, if pregnant or a young woman who is in the age of procreation, if she's obese, then that can be a risk factor for that. So it's not one factor. There are a number of things that can be a risk factor for the poor formation of the spinal cord, and therefore lead to that condition we call neurotube defect.
When does the defect starts to develop? Once a mother gets pregnant, when exactly does that defect starts to be formed? When can it be detected?
Well, that's a good question. What we call neurulation, which is the starting formation of the neuronal tissue immediately after the mother or the pregnant woman gets pregnant, it's generally estimated to start from the 18th day of pregnant, so that's pretty early. And since then, there are quite a number of complex things that takes place in trying to form the brain tissue, and therefore later on form the spinal cord structure. That if anything in that process goes wrong, then we may have one of the many types of neurotube defects, or the different types of spinal bifida. So specifically, usually the whole concept is if any young mother who is planning to get pregnant, the ideal is to recommend her to start taking the folic acid. To be specific, in the Rwandan context, if you get married, or if you plan to get married, because you don't know when your wife will conceive, in our context it's usually early, then you need to start. Or if you're planning your wedding, you need to start, because at the end of the day,
I've just heard this from now, but mothers educated about that they need to be taking folic acid once many or young women that are getting married, because I've just heard it from now. But is it normal that it has been going on telling people to take folic acid? Because I think it's the highest risk factor that leads to that.
Absolutely, it's one that is truly preventable, and the problem is really can be sad if you deliver a baby with a condition that you would have prevented. And I think that's where the message takes. So folic acid is a supplement that is available, cheap, so anybody can have it. The challenge is that we don't have a forum where people who are going to get married or immediate after getting married interact with healthcare professionals to start telling them that. They start interacting with healthcare professionals after they got pregnant, so they start doing their pregnancy follow-up and checkups. And that's, I think, where the gap is. But generally, the issue is you should at least take it at least a month before you get pregnant to have built a a significant amount of stores to be able to say that you are safe into that. And most of us really don't. Most of us, once immediately they know that you're pregnant and you go to the health care professional, the health care professional put you on folic acid supplement. But again, that is after some time, and it depends on how early you seek.
So it means that for mothers that always go for antenatal care, at least they have a chance to have the folic acid given to them.
Yeah, at least, yeah. I would guess I'm not an obstetrician, but that's the recommendation. A mother who's pregnant, you should supplement her with folic acid and sometimes with iron, also to boost her blood levels.
Yeah. When we come back, we're going to talk more on what mothers should be doing to ensure that they don't give birth to children that have backbone defects.